Hey, future nurses, welcome back for another deep dive. This time, we're tackling a big one. You know, that head-to-toe assessment you've got to master. We're going to break it down step by step so you can walk into that practical feeling confident and totally prepared. I remember being in your shoes, and yeah, it can feel a little overwhelming. So many systems to cover, right? So many details to remember. But don't worry, we've got you covered. Think of this deep dive as your secret weapon. All right, so let's map out this journey. First, we'll nail down that all-important introduction. Then we'll move on to the general survey where you take in the whole picture. And then we'll dive deep into a systematic assessment covering all the major body systems. By the end, you'll have a crystal clear picture of exactly what to do and how to do it. So let's start with the introduction. Okay, this is where you set the stage for a positive patient encounter. Remember, you're not just going through the motions here. You're connecting with a real person and putting them at ease. That means walking in with confidence, introducing yourself clearly, and confirming your patient's identity. No room for mix-ups, right? Then you're going to explain why you're there, the purpose of the exam, but in simple terms they can understand. And never forget to obtain their consent. It's all about respect and building that trust from the get-go. Oh, and before you even touch your patient, hand hygiene. That's like fundamental nursing 101, right? All right, so you've nailed the introduction. Now let's move on to the general survey. This is where you take a step back and just observe your patient as a whole before zeroing in on the details. Ask yourself, what's their overall appearance telling me? Do they appear their stated age? Are they well groomed, or is there something off about their hygiene? What about their posture? Are they standing tall, or are they slumped over, maybe hinting at fatigue or pain? All of these observations can give you valuable clues about your patient's well-being even before you start the hands-on part of the assessment. And while you're taking their overall appearance, pay close attention to their body language and emotional state. Do they seem anxious, restless, or withdrawn? Are they making eye contact, or are they avoiding your gaze? Nonverbal cues can be super insightful, right? Because sometimes they reveal more than words ever could. Okay, so now for those vital signs. Pulse blood pressure, respiratory rate, and temperature. You know the drill. These are key indicators of how the body's functioning. You'll need to demonstrate accurate measurement techniques for each of these and be prepared to explain what any abnormal findings might mean. It's all about connecting the dots. All right, you've tackled the introduction and the general survey like a champ. Now it's time for the deep dive, the systematic assessment. This is where you methodically examine each body system, looking for any signs of health issues. We'll start with the skin, the body's largest organ. It's like a window into what's going on inside. So when you're assessing the skin, think like a detective searching for clues. What's the color? Is it pale, flushed, or maybe a bit yellowish? That could signal jaundice, you know? Is the skin dry, moist, or clammy? How does it feel to the touch? Warm, cool, or are there any areas that feel unusually hot or cold? And of course, look for any lesions. Those are any kind of marks or abnormalities on the skin. Are there any rashes, bruising, or unusual areas of pigmentation? These can all be signs of underlying conditions. Don't forget to check skin turgor too. That's how quickly the skin snaps back after you gently pinch it. If it stays tented, it can mean the patient is dehydrated. Moving on to the head, we'll start with the scalp. Gently palpate it, feeling for any bumps, lumps, tenderness, or lesions. And take a look at their hair. The texture, distribution, and cleanliness can sometimes be indicators of nutritional deficiencies or other health issues. Thinning hair, for example, can sometimes point to thyroid problems, while brittle hair might indicate a lack of certain nutrients in their diet. It's all connected, right? Okay, let's peer into the mouth and throat. Remember, oral health is super important. Start by examining the oral mucosa, that's the lining of the mouth, looking for any unusual color changes, lesions, or signs of dryness. Then move on to the gums and teeth. Check for inflammation, bleeding, or any loose teeth. Dental problems can sometimes be a sign of underlying health issues, so don't overlook them. Now have your patient stick out their tongue. You'll want to assess its color, any coatings, and its ability to move freely. And to finish up the mouth, use a tongue depressor to look at the throat. Check for redness, swelling, or any exudate. That's just a fancy word for drainage or pus, which could indicate an infection. If your patient has tonsils, be sure to note their size and appearance. Remember, tonsils are graded on a scale from 1 to 4, with 1 being barely visible and 4 being practically touching. Right, time to shine a light on those peepers. The eye exam might seem a bit daunting at first, but it's really about observing and testing a few key things. Start by looking at the eyelids, noting any drooping, swelling, or redness. Then examine the eyelashes, making sure they're pointing in the right direction and aren't harboring any debris. Next, gently pull down the lower eyelid to examine the conjunctiva. That's the membrane that lines the inside of the eyelid. It should be pink and moist. Redness could indicate irritation or infection. Now for the pupils. Shine your pen light into each eye and observe how the pupils constrict in response to light. They should be equal in size and react briskly. Unequal pupils or sluggish responses could be a red flag. You know something to investigate further.
To test extraocular muscle movements, or EOMs for short, have your patient follow your finger with their eyes as you move it in an H pattern. This checks how well their eye muscles are working together. And don't forget a visual acuity test, even if it's just a basic one using a Snellen chart. This gives you a quick assessment of their vision. Moving on to the ears, start by observing the outer ears for symmetry and any obvious abnormalities. Then gently palpate the tragus, that's the little bump in front of the ear canal, and the auricle, the outer part of the ear, checking for any tenderness. Next, you'll need an otoscope to look inside the ear canal. Gently pull the ear back and upward to straighten the canal, then carefully insert the otoscope. Look for any redness, swelling discharge, or excess cerumen. That's earwax in plain English. Finally, focus on the tympanic membrane or eardrum. It should be pearly gray and slightly cone-shaped. Redness, bulging, or perforations could be a sign of infection or other ear problems. Now let's move on to the nose and sinuses. Begin by inspecting the external nose, noting its shape symmetry and any skin changes.
Then using a pen light, look inside each nostril, checking for any redness, swelling discharge, or polyps. Polyps are small growths that can obstruct breathing. And finally, you'll want to gently palpate the sinuses, the frontal sinuses above the eyebrows, and the maxillary sinuses on either side of the nose. You're checking for any tenderness that might indicate sinusitis. Nobody likes a sinus infection right now, say. Okay, we've made it to the neck. And let me tell you, there's a lot going on in this area. Start by observing its overall appearance. Does it look symmetrical? Are there any obvious masses swelling or unusual pulsations? Then assess your patient's range of motion by having them tilt their head forward, backward, and side to side. Can they move their head freely without pain or limitations? Next, it's time to feel for the thyroid gland. It's located in the lower front of the neck, just below the Adam's apple. Gently palpate the area, feeling for any enlargement, nodules, or tenderness. An enlarged thyroid could signal a problem with thyroid hormone production, so it's important to check. Now for the lymph nodes. You'll want to systematically palpate the major lymph node groups in the head and neck, feeling for any enlargement or tenderness. Remember, enlarged lymph nodes could be a sign of infection or other illnesses. It might help to visualize a roadmap of the lymph nodes in your mind as you go. Start with the preauricular nodes located just in front of the ears. Then move to the postauricular nodes behind the ears. Next, check the occipital nodes at the base of the skull. Now move down the sides of the neck, palpating the posterior cervical chain, then the anterior cervical chain. Next, feel for the tonsillar nodes just below the angle of the jaw. Then check the submandibular nodes under the jawline, followed by the submental nodes right under the chin. And finally, palpate the supraclavicular nodes located just above the collarbones. Phew, that's quite a journey, right? But with practice, this sequence will become second nature. And while you're feeling for those lymph nodes, don't forget to check the carotid arteries. These are the major blood vessels that supply blood to the head and brain. Gently palpate one carotid artery at a time, feeling for the pulse. Never palpate both at the same time, though.
Okay.
That could disrupt blood flow to the brain, and we definitely don't want that. All right, let's move on to those upper extremities, starting with the arms and hands. Observe their overall appearance. Are they symmetrical? Is there any swelling, redness, or discoloration? Check for any deformities or limitations in range of motion. Have your patient flex and extend their elbows, wrists, and fingers, noting any pain or stiffness. Next, assess muscle strength by having them resist as you apply gentle pressure to their arms and hands. You're looking for any weakness or asymmetry that could indicate a neurological problem. And don't forget those fingernails. Their color, shape, and texture can reveal a lot about overall health. For example, clubbing, where the fingertips become enlarged and the nails curve downward, can be a sign of lung disease. Interesting, right? Okay, now let's focus on the front of the chest, also known as the anterior thorax. Start by observing the chest's shape and symmetry. Is it barrel-shaped, which could suggest a lung condition? Are there any noticeable depressions or protrusions? Next, palpate the chest wall, feeling for any tenderness, masses, or crepitus. Crepitus feels like crackling under the skin and can indicate air trapped in the tissues. Now it's time to put on your stethoscope and listen to those lungs. Starting at the top of the chest, place your stethoscope on the skin and have the patient take a deep breath through their mouth each time you move the stethoscope. Listen carefully to the breath sounds on both sides, comparing one side to the other. Normal breath sounds should be clear and effortless. Crackles, wheezes, or diminished breath sounds could indicate a respiratory problem. Okay, next we'll shift our focus to the heart. Using your stethoscope, you'll listen to heart sounds at specific locations on the chest. Remember the mnemonic, all people enjoy Time magazine. That'll help you locate those key areas. Aortic pulmonic herbs, point tricuspid in Mistral, Listen carefully for the rhythm and regularity of the heartbeat, as well as any unusual sounds like murmurs, which can indicate problems with the heart valves. Moving on to the abdomen, the land of digestion, and all sorts of interesting sounds. Begin by observing its contour. Is it flat-rounded or distended? Check for any visible pulsations, which could indicate an abdominal aortic aneurysm. Also note any scars, strigae, stretch marks, or skin discoloration. Now for the fun part, listening to bowel sounds. Using your stethoscope, listen in all 4 quadrants of the abdomen, starting in the right lower quadrant and moving clockwise. Normal bowel sounds should be gurgling and fairly frequent. Absent or hyperactive bowel sounds could signal a problem. While you're listening, take a moment to auscultate over the aorta in the upper abdomen just below the rib cage. You're listening for a bruit, which is a whooshing sound that indicates turbulent blood flow, potentially caused by an aneurysm. Next, we'll percuss the abdomen. Percussion involves tapping on the abdomen to assess the size, density, and location of underlying organs. It can also help detect any fluid or masses. You'll be listening for different sounds. Tympany, which is a drum-like sound usually heard over air-filled structures like the intestines. And dullness, which is a thud-like sound heard over solid organs like the liver or spleen. Finally, palpate the abdomen. Start with light palpation using your fingertips to gently press down about ½ an inch. This helps you get a sense of the abdominal wall and identify any areas of tenderness or superficial masses.
Then move on to deep palpation using firmer pressure to assess deeper structures. Note any masses, organ enlargement, or pain. Okay, we're almost there. Let's take a look at those lower extremities, starting with the legs and feet. As with the upper extremities, observe for symmetry, swelling, redness, or any unusual skin changes. Check for varicose veins, those enlarged, twisted veins that are often seen in the legs. Also note any ulcers or sores, which can be a sign of circulatory problems. Next, assess range of motion in the hips, knees, and ankles, having your patient flex and extend each joint. Note any limitations, pain, or crepitus in the joints. Then assess muscle strength by having them resist as you apply pressure to their legs and feet. Again, you're looking for any weakness or asymmetry. Now, one of the most crucial aspects of assessing the lower extremities is checking the circulation. This involves palpating the pulses in the feet, the dorsalis pedis pulse on the top of the foot, and the posterior tibial pulse behind the inner ankle bone. You'll also want to check capillary refill by pressing on the patient's toenails and noting how quickly the color returns. Sluggish capillary refill can indicate poor circulation.
And before we move on, don't forget those toenails. Just like fingernails, they can provide clues about overall health. Look for any thickening, discoloration, or fungal infections, which can be more common in people with diabetes or circulatory problems. Okay, we've covered a lot of ground. Let's turn our attention to the back or the posterior thorax. First, observe the spine's curvature. Is it straight, or are there any abnormal curves like scoliosis? Have your patient bend forward at the waist so you can get a clearer view of the spine's alignment. Next, palpate the spine, feeling for any tenderness, muscle spasms, or unusual prominences. Then, using your stethoscope, listen to the lung sounds on the back, comparing one side to the other. Just like with the anterior thorax, listen for the clarity of breath sounds and note any abnormal sounds. Finally, you'll want to percuss over the costovertebral angle, CVA. This is the area on the back where the ribs meet the spine. Tenderness in this area can be a sign of kidney problems, so it's an important area to check. Whew, that was a whirlwind tour of the body, huh?
Yeah.
But don't worry, you'll all become more familiar with practice. You're doing great. Just keep practicing and visualizing each step, and you'll be a head-to-toe assessment pro in no time. All right, welcome back, nursing students. We're diving right back into that head-to-toe assessment deep dive, so grab your stethoscopes and your thinking caps because it's neuro time. I know this part can feel a little intimidating, but trust me, it's all about breaking it down step by step, just like we did with the systemic assessment. So first things first, we got to assess the patient's level of consciousness. This tells us how aware and alert they are. Are they fully awake and responsive? Or are they drowsy, confused? Or even worse, unresponsive? Any change in their level of consciousness can be a sign of a serious problem. So we got to assess this accurately. Once we've got a handle on their level of consciousness, we'll move on to assessing their orientation. This means figuring out if they know who they are, where they are, and what day it is. You know basic stuff. We can ask simple questions like, can you tell me your name? Or do you know where you are right now? And what's today's date? If they can answer all these questions correctly, we consider them oriented to person, place, and time. But if they're disoriented, well, that could point to a whole bunch of different conditions, from head injuries to infections to even medication side effects. So it's a really important clue. Now let's talk about the FAST exam. You know face-arm speech time. This is like your rapid response tool for identifying a potential stroke. And believe me when I say this, every second counts. So here's the deal. We ask the patient to smile, and we check, does one side of their face droop? Then we have them raise both arms and we watch does one arm drift downward. Next, we ask them to repeat a simple sentence like the sky is blue, and we listen carefully. Is their speech slurred or difficult to understand? If you notice any of these signs, even just one face, it's time to act fast. Call 911 immediately because with a stroke, time is brain. Okay, now let's move on to assessing those cranial nerves. There are 12 of them, each with its own special job. They control everything from our senses to our facial expressions to our muscle movements. Now, testing all 12 can take a while, but for your head-to-toe assessment, you'll likely focus on a few key players. So let's start with cranial nerve V, the trigeminal nerve.
This nerve is responsible for sensation in the face and for controlling those chewing muscles. So to test it, we simply ask our patient to clench their teeth while we feel the muscles in their temples and jaw. The strength should be equal on both sides. Next, let's check cranial nerve 12, the hypoglossal nerve. This one controls tongue movement. Easy enough to test right. Just ask the patient to stick out their tongue. We're looking to see that it protrudes in the midline without any deviation to one side. All right, now let's move on to the eyes. We're going to be testing 3 cranial nerves here that work together to control eye movements. Cranial nerves, the 3rd, 4, and 6, those are the oculomotor trochlear and abducens nerves. Don't worry too much about those names though. What matters is what they do. So to assess these nerves, we're going to do that same extraocular movement test that we did during the eye exam. Remember the H pattern. We have the patient follow our finger with their eyes as we move it smoothly through that H shape. And as they're doing that, we're watching for any jerky movements in the nystagmus or an inability to move the eyes in a certain direction.
All of those could signal a problem with one of these cranial nerves. All right, moving right along, let's check cranial nerves IX, and X the glossopharyngeal and vagus nerves. These nerves play a role in swallowing the gag reflex in the voice. So to assess them, we simply have our patient say, ah, and we watch how their uvula moves. You know that little teardrop-shaped thing that hangs down in the back of the throat? Should rise symmetrically. If it deviates to one side, though, that could indicate a problem with one of these nerves. Last but not least, we'll test cranial nerve XEI, the accessory nerve. This one controls the muscles in the neck and shoulders. So to test it, we ask the patient to shrug their shoulders against our resistance. We're looking for equal strength on both sides, of course. Okay, we made it through the cranial nerves. Now let's move on to assess motor strength and coordination in the limbs. This part of the nerve exam focuses on how well the brain is talking to the muscles and how well those muscles are listening and responding. So to assess motor strength in the upper extremities, we have the patient squeeze our fingers with each hand. We're checking for equal strength on both sides.
Then we have them resist as we try to bend and straighten their elbows and wrists. Easy peasy. For the lower extremities, we have the patient push their feet against our hands and then pull their feet upward against our resistance. Again, we're looking for equal strength on both sides. Now let's talk coordination. This involves the smooth, integrated movements of multiple muscle groups working together. To assess coordination in the upper extremities, we have our patient touch their nose with their index finger, first with their eyes open and then with their eyes closed. And we observe the smoothness and accuracy of their movements. For the lower extremities, we can have the patient run their heel down the opposite shin. They should be able to do this smoothly and accurately. All right, now let's shift gears and talk about sensory perception. This part of the exam checks how well the nerves are transmitting sensations from different parts of the body to the brain. So we'll be testing for light touch, pain, temperature vibration, and position sense, making sure all the signals are getting through loud and clear.
To test light touch, we can use a cotton ball or our fingertips to gently touch different areas of the patient's skin. And we simply ask them to tell us when and where they feel it. To test pain perception, we use a sharp object like a broken tongue depressor and a dull object like the rounded end of a pen. And we have the patient tell us if they feel sharp or dull sensations. Makes sense. To test temperature sensation, we can use a cold object like a metal tuning fork and a warm object like a test tube filled with warm water. For vibration sense, we use a vibrating tuning fork and place it on bony prominences like the wrist, ankle, or big toe. And we ask the patient if they can feel the vibration. And finally, to test position sense, also known as proprioception, we move the patient's fingers or toes up and down. And we ask them to tell us which direction we're moving them without looking. It's a good way to check if their brain is getting the right messages about where their body is in space. Okay, we're in the home stretch of the neuro assessment. Let's wrap things up by taking a look at the patient's gait and balance. This can actually tell us a lot about their neurological function.
So to assess gait, we have the patient walk across the room and back. As they're walking, we're observing their posture, balance, arm swing, and the way their feet strike the ground. Does their gait appear smooth and coordinated? Or is it unsteady shuffling or wide-based? Any abnormalities could point to a neurological issue, so we got to pay attention. Now, to assess balance, we have the patient stand with their feet together and their eyes closed. We're looking for any swaying or unsteadiness. We can also ask them to stand on one foot, then the other, to further challenge their balance. If they have difficulty maintaining balance, it could suggest a problem with their cerebellum. That's a part of the brain responsible for coordination balance. All right, folks, we did it. We just navigated the neurological assessment like pros. I know it's a lot of information, but the key is to practice these steps and really understand the why behind each test. That's how you build confidence. And remember, this isn't just about memorizing a bunch of steps. It's about developing those clinical reasoning skills, the skills you'll need to accurately assess your patients and provide them with top-notch care. Okay, welcome back for the final part of our head-to-toe assessment deep dive. We've covered a ton of ground, haven't we? From the initial greeting to the in-depth neurological exam, you've officially journeyed through every step. But we're not quite done yet. We've got to talk about the closing. Now, this might seem like a simple step, but it's actually super important for wrapping things up professionally and leaving your patient feeling like, cared for and informed. Remember, this is the part they're going to remember most vividly, so let's make it count. First things first, we got to summarize our findings to the patient. And we got to do it in a way that makes sense to them. No medical jargon allowed. Okay. Just clear, simple language that anyone can understand. So instead of saying, your lungs are clear bilaterally, we could say, your breathing sounds great, nice and clear on both sides. See the difference? Now, as you're summarizing, be sure to address any concerns or questions they might have. This is where those active listening skills come in handy. Give them your full attention, make eye contact, and let them know you're genuinely interested in what they have to say. And don't interrupt or dismiss their worries, even if they seem minor to you. Every concern is valid. Now, if you identified any issues during the assessment, this is the perfect time to provide some patient education. Explain what you found, what it might mean, and what steps they might need to take next. If it's appropriate, you can offer resources or referrals to specialists. Remember, knowledge is power, and when we empower our patients with information, we're giving them the tools they need to take control of their health. And finally, thank the patient for their time and cooperation. Let them know you appreciate their trust in you. And as you conclude the examination, do it professionally and respectfully, leaving them feeling confident in your abilities and cared for as a person. That's what it's all about, right? Connecting with our patients on a human level. All right, folks, that's a wrap. We've officially covered every single step of the head-to-toe assessment, from the moment you walk into the room to the moment you say goodbye. I know it's a lot to take in, but remember, practice makes perfect. So go out there, practice those steps. Visualize yourself performing assessments smoothly and confidently, and trust in your abilities. You've got this. And as you embark on your incredible journey as a nurse, remember that the head-to-toe assessment is more than just a checklist. It's the foundation of providing excellent patient care. It's about seeing the whole person, listening to their story, and using your knowledge and skills to help them achieve their best possible health. So keep that passion for learning burning bright, and I'll catch you on our next deep dive.